I had that discussion with my dad, and he was like, it'd probably be a good idea to have at least one doctor in the family. It was based off of that discussion, like literally 2 days after I was flown into Jamaica. Because as I said, I did get accepted to engineering in Trinidad, and that was my plan. But after that discussion, it was kind of like a last minute decision to just go to Jamaica and do medicine. It was like adjusting to living on Hall. I went to Hall, and I was kind of like a big culture shock. Nice home with my siblings and going to like a hall where you didn't know anyone. That was like a big shock. I would say it wasn't about more so like me actively networking. I think it was just me being nice to people, like me being nice to that nurse back in Trinidad, having a good relationship with her, just talking to her, seeing how she's doing, and just her having a good relationship with me. I telling her, well, this is what I'm planning to do. And then she was like, oh, I know this person. And then when I met that person, he was like, be nice to him, make sure that he knows who you are, set a good example. When I did apply, what I did do, I had like a spreadsheet that I made, and I called a lot of programs to see whether or not they were willing to take international medical graduates. And if they said yes, I would apply. If they said no, I would kind of X them off of the list. In the US, I was surprised. Med students here, they do a lot of research. I wanted to make sure that I left the door open for other international medical graduates. So I wanted to make sure that when I leave Howard University, they would realize that there's a good market of doctors outside of the US called IMGs.
Hello. You're listening to the IMG Residency Match podcast, where ambitious international medical graduates like yourself get the insider strategies and inspiration you need to match into residency. I'm your host, Shauna K. Lester, the founder of Memorable Essay and the creator of the IMG Residency Match Application Accelerator, a program that helps you create a memorable residency application to match. So if you're looking for proven strategies to match and the inspiration to create a medical career you absolutely love, you're in the right place. Let's get into it. Dr. Rodney Guiseppi was almost an engineer. Today, he's a father, a husband, a soccer enthusiast still, and an ophthalmologist who has a special interest in the surgical management of diabetic retinopathy. Born in Trinidad and Tobago into a large family, his journey has taken him to Jamaica and Belize, to Washington, D.C. for ophthalmology residency, and to Texas for a surgical retina fellowship. In this episode, we're talking all about his love for ophthalmology, the role that mentorship has played in his career, his tips for you as you navigate the match, and the mark he wants to leave on the field of ophthalmology. So welcome to the IMG Residency Match podcast, Dr. Rodney Guiseppi from Trinidad and Tobago. I am really excited to get into this conversation with you today, to learn all about your road to ophthalmology and the amazing work that you're doing now for your patients. And of course, to let others know that this is also a path that is possible for them. So welcome.
I'm happy to be here.
If you were supposed to tell someone who is Dr. Rodney Guiseppi, what would you say?
Well, I would say I am a native of Trinidad and Tobago, born and bred, grew up in Trinidad and Tobago, was educated mainly in Trinidad and Tobago. I'm from a big family, have about 6 siblings, all grew up together with them, from a house that is very sport oriented. So grew up playing a lot of sports. I played a lot of soccer mainly, played some tennis, did some swimming. Yeah, grew up in that kind of a background. Now I'm doing ophthalmology in the US, so I'm happy to share my journey with you guys.
Thank you so much. What was your favorite sport growing up?
I would have to say it would have been soccer.
Did you play often?
Oh, yeah, it was kind of like, at least in high school, I would say I probably played almost every day. Played for my school, I played for a team as well. So I'd go training after school.
And so nowadays, what do you do? Like, tell us about your job. What do you do for work? When someone does a surgical retina fellowship, what is that about and what do you do for work? When would we see you? When would we come to you as our doctor?
Basically, in my clinic, I would mainly see a lot of patients who have diabetic retinopathy, and so with age-related macular degeneration. I would see patients who have other vascular eye disease like retinal vein occlusion, and I see patients who have like retinal detachments, which could be different forms of retinal detachments, and those are the patients that would probably take to surgery.
So how do we get there? Tell me about Rodney in primary or prep school in Trinidad and Tobago. Is that when you fall in love with medicine, or it happens earlier or later?
Man, to be honest with you, I never thought about becoming a doctor until maybe after I took my CAPE exams. That is the one who kind of more or less encouraged me to do medicine. I was planning to become an engineer. It was kind of like a last minute decision. So in prep school, primary school, and secondary school, it was all about like, I love maths, going to be an engineer someday. Growing up as a child, I would like to like break down my toys and see how it works and try and fix it. I was that type of person. And then when I was applying for university, I actually did apply for engineering in Trinidad. I was actually accepted, but my dad encouraged me to also apply for medicine. So he kind of did most of the paperwork in the application. So when I was accepted to both, I had to make that decision whether or not I should do medicine or pursue engineering. And even when I was in Form 6, I guess would be the level before you go to university, the subjects I did were more geared towards doing engineering. So I did like maths, I did chemistry and physics. I didn't do biology. So in some places, I have to do biology. So I was like, man, I'm probably not going to get into medicine. But yeah, I was fortunately accepted into medicine. And I had that discussion with my dad, and he was like, it'd probably be a good idea to have at least one doctor in the family. It was based off of that discussion, like literally 2 days after I was flown into Jamaica. Because as I said, I did get accepted to engineering in Trinidad, and that was my plan. But after that discussion, it was kind of like a last minute decision to just go to Jamaica and do medicine.
Did you know anybody in Jamaica, or you were starting from scratch?
Know anyone in Jamaica, but thankfully, people in Jamaica were very nice to me. Once I got there, I had a lady called Maxine who just became like one of my mothers in Jamaica, and she kind of just took me under her wing and showed me the ropes, made sure I was comfortable, made sure I had good accommodation and so forth. But it was a big adjustment because, as I said, like I was planning to do engineering, and now I'm in this foreign land.
Yes.
Where I don't know anybody and going to do a field that I wasn't really planning to do. Yeah.
And I'm smiling too because if there's like a typical Jamaican name, it's Maxine, like a Patsy or a Maxine. That's funny. Okay. Well, I'm glad that Maxine was able to help you to transition. What were some of the most difficult parts of that transition? Just that it all happened within 2 days, or?
It was like adjusting to living on hall. I went to hall and I was kind of like a big culture shock. Nice home with my siblings and going to like a hall where you didn't know anyone. That was like a big shock. I mean, I love the food. I love the Jamaican culture. And what else was more challenging is like just trying to learn a lot of the basic biology and stuff to have a good foundation for medicine. I think that was also like a big struggle for me.
So what do you decide to do after medical school, and how does that lead you into the match?
Even when I was in medical school, I didn't understand that you had to do a residency. A few years into medical school, I was like, man, what is residency? And I think maybe later on, like during medical school, before we did our final clinical rotations, we had some people who would come on the campus and talk about the Kaplan live test prep that they had. They were offering it in Jamaica at that time. And that's when I was first exposed to doing the USMLE. And I told myself, I'm probably not going to do it. I was just planning to go back to Trinidad and probably be a GP. And then when I started my clinical rotations, I had really fell in love with anesthesia. Telling my mom, I want to be an anesthesiologist. I had really, really loved it. Like there was just something about it, maybe just all the
The
drugs.
math and the chemistry.
I was like, man, I'm going to do this for sure. And then I was speaking to my mom about it, and she was like telling me anesthesia is a good field, but it would be better if you can get into a field where you're not so dependent on a hospital, where you can have your own practice and have more flexibility. I think there was some point in time, maybe during my anesthesia rotation, I probably saw like maybe a few eye surgeries, and I was like, maybe this is interesting. And then I heard about my grandmother who was back in Trinidad, who was blind from diabetic retinopathy. And then she had a surgery and then she was able to see again. And I think the way how she spoke to me is almost like it was like a life changing moment where at one time she was like almost completely blind and now she's able to see to take care of herself. I think that was kind of one of the main driving factors for me choosing ophthalmology. Now, me choosing ophthalmology was kind of like, man, this is probably very difficult. I didn't even understand how competitive it was to get into like a residency in the US, far less ophthalmology.
Yes.
Yeah, so that's how I decided to do ophthalmology. I would say once I had finished med school during my internship and I decided that I'm going to try and do a specialty in the US, I signed up for the Kaplan Life test prep, which was in the Washington, D.C. at that time. And during my internship, I started reading the books that they had sent me, started doing questions. And then maybe like 2 days after internship, I flew to DC and I took the course. I think the course was about 3 or 4 months where you
Mm.
go classes every day.
And so that served as your initiation to get you started.
Yeah, and while I was doing my internship, I was fortunate enough to meet a nurse who actually worked at the hospital where I was doing my internship. She had actually trained in the US, so she knew a ophthalmologist who used to attend the same, I guess, church that she attended. And she was like, man, if you go into DC, she can put me onto him. And she did put me onto him. His name is Dr. Barnes. And once I landed in DC and I was settled, I kind of just went and I introduced myself to him. Thankfully, he was one of the ophthalmologists who really tries to help people in the underserved community get into medicine. So he had like a passion for that. Essentially, what he said to me was like, right now, just focus on your exams, trying to get good scores. And then once you finish your exams, I could come and work with him or come to his office and he will see how he can help me get into ophthalmology. He also is like a professor or associate professor at Howard University. So once
Yes.
I had a good rapport with him, he got to know me a little bit better. He said, maybe I should come to Howard with him. And essentially, what he said is like, you try and be like an unofficial resident. So essentially, I would try and help the residents who are already training have a more smooth clinic flow. So I would help with screening patients, checking their vision, and so forth, and just helping them get through the day essentially. During that time as well, I also kind of did like some research with the chair of the program there. Just being immersed at like an academic institution as a foreigner kind of helps them to know who you are, have a better relationship of at least understand who Rodney Guiseppi is essentially. And then essentially, when you apply for like a residency, they have like a face, they have a personality, they know your work ethic rather than just submitting an application and you have a lot of good credentials, but they don't necessarily know you as a person. Now, I was fortunate in the sense that they were willing to do that, like unofficially have me there helping. I know it's very difficult for a lot of people to get into like something like that. I know sometimes you have to pay a lot of money to get it, but I was just fortunate where they were like, man, if you want to come, you just come.
A quick pause to thank our sponsor, the IMG Residency Match Application Accelerator. The IMG Residency Match Application Accelerator helps international medical graduates like you create a memorable application to match. Learn more at bit.ly/IMG match. Now back to the conversation. Well, you are essentially, it sounds like, his mentee, and this is something I think about a lot because I came of age in the 90s. It makes me sound so old, but I think I'm from an era where people, my high school principal, we could talk all day if I started talking about my mentors, but just people who would open their door and say, come, right? When I went to college, I had so many people do that for me, like people in pharma companies, biotech, medicine, like every career I thought of, somebody was like, oh, just come with me and like see what I do. And I think we're a bit in like a different age now where everything is like, under the banner of coaching and consulting and you have to pay for it. But I think, there was a time when people would definitely just say, just come and be here and see what I do and you will learn.
I was fortunate enough because, as I say, like once COVID happened, things got a lot more difficult for people to just come in and just be in the hospital because there were all these restrictions placed even for a place that was as open as Howard University. So as I
Yeah.
say, I was very, very blessed in that.
You go and you essentially take this time off. You do Kaplan. Did you manage to do all your steps, or you started with one step first?
I did all my steps within like a year and a half.
Okay. All right. So you're doing this with the guidance from Kaplan. You get the steps done.
Step twos, I was able to do it on my own. Yeah.
What did you do with Kaplan?
Step one.
Okay. Oh, the step one. Then you prepare yourself for step two, and you are having this observership slash, externship experience in Washington, D.C.
Mm-hmm.
How does it go from there? Like, does that experience make you 100% sure that ophthalmology is for you?
Yes. Yes, for sure. Yeah. Whether or not I would have gotten in was a different story, but I was just willing to just put all my eggs in that basket and just hope for the best. So I didn't have like a backup plan per se. It's more like if I didn't get through, I'd probably try and apply again.
And you mentioned your dad. So your daddy is telling you we should have a doctor in the family, which is true. I think someone in the family needs to understand healthcare and how to navigate the system. Your mom is telling you think a little bit broader than anesthesiology. Tell me a little bit about your parents. They seem like they've been very amazing guides for you along the way.
They have been very good parents, very supportive. My dad, he was in banking. My mom was like an economist, but then she decided to be a mom who just took care of us. As I said, we had a lot of siblings, so she essentially focused her energies on making sure that we got a good education, making sure we're exposed to sports and so forth. They did set a very good example in like how to be like good people in general.
What would you say to somebody who they might be more introverted or quiet? They're going into the match for something highly selective, but they really should try to form relationships with people or to network as a part of that process. How does one get started when it comes to building relationships so people can see your amazing work?
I would say it wasn't about more so like me actively networking. I think it was just me being nice to people, like me being nice to that nurse back in Trinidad, having a good relationship with her, just talking to her, seeing how she's doing, and just her having a good relationship with me. I telling her, well, this is what I'm planning to do. And then she was like, oh, I know this person. And then when I met that person, he was like, be nice to him, make sure that he knows who you are, set a good example. And then he realizing that, you might be a very good fit for this program, saying, maybe you should come to this place. I'm not like a person who was like trying to send emails, and maybe that may work for some people, but it was just my demeanor, my personality essentially.
So you hear that for everyone who's applying to the match, be nice to everyone who you are working with because you don't know the impression that you're making. So you apply to the match. Were you nervous going through the process? Like, how was your interview season?
When I did apply, what I did do, I had like a spreadsheet that I made, and I called a lot of programs to see whether or not they were willing to take international medical graduates. And if they said yes, I would apply. If they said no, I would kind of X them off of the list. Some programs were nice enough to tell you, like, this is like the minimum score requirement that they would accept. And if I didn't meet that minimum, I would just not apply to those programs. So I did apply to as much programs as I could have. In my particular situation, I didn't get a lot of interviews. I got 2 interviews. One was at Howard University and the other was at Georgetown University in Washington, D.C. And, sometimes people may get a lot of interviews. Some people may only get 1 interview, but I would say it's not about how much interviews you had, but I would say it's like the impression that you have left during the interviews. Or, as I said, for my particular situation at Howard, they actually knew who I was. I was there for about almost a year. So I was still kind of not sure if I would have matched, but I was kind of optimistic that there's a good chance that I would have matched because a lot of the residents there, they were very nice and they really wanted me to get matched into ophthalmology at Howard University.
And now that you're in residency, how do you make a good impression?
Well, I wanted to make sure that I left the door open for other international medical graduates. So I wanted to make sure that when I leave Howard University, they would realize that there's a good market of doctors outside of the US called IMGs that will will add a lot to the program. So
Yeah.
I really had during my time at Howard University. There was this book set called the BCSC. I probably read those books like 2.5 times. It's like 13 books. And I tried my best to study well so that whenever we did our annual exams, I would have done really well. I made sure that if I got called in, I would go in. It was tough. I think a lot of people think ophthalmology might be like one of those fields where it's not busy. I thought probably that would have been the case, but no, it was like a very tough experience because you can get called out all hours of the night. And I think once you demonstrate that you're very dependable, you're willing to learn from your mistakes, I think that goes a long way in the program directors, the chair of the department, having a good impression about you, essentially. I was somebody who, if someone didn't want to do something, I would say, I would try and just do it just to get stuff done and try to be a very good team player, essentially.
And you decide that you want to do fellowship. Why and when?
During my residency, I actually had the idea of just going to try and do glaucoma. But then I think there was a switch sometime in residency, and I just felt like this may sound a little bit weird, but I just felt like the subspecialty of vitreoretinal surgery is almost like that field where you should be able to take care of anything in the eyes. You don't necessarily have to refer. I mean, obviously, there are some things that we can do, but it's like if someone has really bad trauma to the eyes, or if someone has like a really complicated surgery, a lot of times those patients will go to like a vitreoretinal surgeon to kind of help take care of things. And I wanted to be that person, like the go to person. I didn't want to be the person who was like referring. I felt like if I didn't do it, I wouldn't be like a full ophthalmologist, essentially.
So you can give patients a complete solution.
Yeah, I mean, there are limitations and things that we can do. We focus mainly in the back of the eye, which is like a very important part of the eye, but a lot of things end up coming to us. Like if someone had a cataract surgery and they had an infection, or if someone had like a glaucoma surgery and then they have something called like a suprachoroidal hemorrhage, they'll come to us. If someone has like severe trauma with a foreign body in the eyes, they will come to us. Like just those little things, I felt like I wanted to have the skill set to take care of those things essentially.
So looking back, outside of being nice to people every day, what would be some of the strategies that you would share with someone who's applying to the match? So the process for the match, there are things that have changed over the past, 10 years, 15 years. But at the core, they require the same things and are just really trying to get applicants to showcase the best of themselves. And most IMGs still are juggling a job somewhere with the match, maybe family responsibilities. They might be married already, or they might be taking care of relatives. What would you say to them about how to stand out in the midst of everything that they have going on?
I think if you're in a situation where you have the ability to go to like a program that is known to be friendly to IMGs and like spend like maybe 2, 3 months where they actually know who you are, I think that helps a lot. Back when I did it, there was like a score system where they'd use like a specific score as a cutoff. I don't think they have that anymore, but I would say like just making sure that you pass your exams on your first try, that's very helpful. In the US, I was surprised. Med students here, they do a lot of research, a lot of research. And I think that's one of the things that I was unaware of coming in from the Caribbean into the US. Like during my fellowship, I did my fellowship in Texas. I would like look at some of the CVs or the resumes of some of those med students. And it was like, wow, these students are doing like, some of them have like 20, 30 publications. And us in the Caribbean, or at least myself, I was like, this is just unfamiliar territory. We have no idea of like how competitive it is until you actually kind of get exposed to like what some of these US students are doing. So I would say if you can get involved in doing some research, if you can't do like any big research, doing a lot of like case reports. If you can attend conferences and you can present like interesting cases in the US, what else I would say is helpful? Try to reach out to residents in some of the programs that you might be interested in and see if they can help you. Because literally, like I was able to help another colleague of mine who came from Trinidad. He literally just reached out to me and I told him, just come. Just told him what I did. He kind of essentially did something similar to what I did. And thankfully, he also matched as well. And yeah, he actually just finished his residency at Howard University as well. So yeah, I think if you can also reach out to other people who are like actually in a residency program, that helps as well.
And if we might veer a little bit into the personal realm of things, you have a family. As it relates to your children, what are you most proud of them seeing as it concerns daddy's job?
Man, I have two boys. One is 3 months and one is 2 years old. I just like to just leave like a legacy where they actually see that their dad is going to work, trying to help people see. They know that I come home late sometimes. Where I work in Southern Illinois, some weeks I'm on the road 10 hours just commuting. Like some days I have like a 2.5 hour drive to some of the clinics one way and then 2.5 hour drive back. But I think like I always try to, whatever I do it heartily as unto the Lord, so that when I look back, at least I know I did my best. And I think I try to leave a good legacy for my children where whatever they do it to the best of their ability, so that when they look back, even if things didn't go as planned, at least they know that they did their best. And patients really appreciate that, knowing that sometimes you do a surgery, you did your best, and for whatever reason, the results were not as good as you expected. At least the patients appreciate that you tried.
What do your patients tell you that they most appreciate you for? Like when you get your feedback from patients, what do they say? What do they look forward to working with Dr. Guiseppi for?
Actually, yesterday I had a patient. She was like 84 years old, nice lady. She had macular degeneration and she had some other problems. And she had really liked how I took time to explain stuff to her. And each time she would come with like a different daughter. She was like, she really wanted each of her daughters to meet me. I felt so touched by that, where she had really loved me that much, where she was like, man, I want all of my daughters to just meet you. And at the end of the encounter, she was like, I just love you. And I felt so touched by that. She was so happy that I just take the time to explain stuff to her.
Well, thank you so much for chatting with us today, Dr. Guiseppi. I think we got a lot of excellent information from you. I hope the research bit stood out a lot, because I do find that that can indeed be a huge shocker. Sometimes I'm talking with applicants and encouraging them to put on whatever research they did as a medical student, and they're like, oh, that or that case presentation. I'm like, yes, that one, because other people are going to have research. And so you need to as well. So thank you so much for sharing all of your wisdom and for being so transparent about how you got to where you are and the work that you're doing to improve other people's lives currently.
Thank you so much. It was a pleasure.
Hey friend, thank you for listening to the IMG Residency Match podcast. If you're ready to create a memorable application that gives you the best possible odds of matching into residency, connect with me at bit.ly/IMG match. That's all lowercase. And you can find me on Instagram, YouTube, and Facebook at Memorable Essay, or handle is Memorable Essay. If you enjoyed this episode, be sure to follow, leave a review, and share it with another IMG who's on their match journey. Your support helps more ambitious IMGs to find our show. Until next time, keep focused and be memorable.